So, do we have any questions for our well, three last speakers?
Virapong, I was wondering, did you cite someone's research by the name of Moto?
Yeah. It's a city model illustrated by walk out and Michael what type?
Michael DeMoto?
Yeah.
Thank you.
Do you find that there is any common ground between Rodriguez and your work, Virapong?
The common ground of the theory. Just hearing that.
Well, the way that you're handling your research and your signs.
Yeah, I apply the theory and the questionnaire responses in order to navigate me to design the platform. I have no idea how to categorize the feature to let them to design their signs and symbols, and I want to know what features that I have to deliver into the platform to allow them to freely design based on the standard of the warning system, one design system.
Is it possible that you can help each other?
Yeah, I think so. Yeah.
Okay, well that's really good. That's very fortunate. Wonderful. So, do we have any more questions then from anyone for the three last speakers?
Well, I was very impressed from Rodrigo presentation. I think it's an answer for questions that we asked before. If the authorities are really into it, I think they could make a change. They could educate. They could increase public awareness, educating children. If they dedicate the time, it's great, really.
Yeah, just to comment, probably 7 or 8 years ago, when I started to work in a scientific center, the National Disaster Research Center, the question was, what is doing a designer here? We are scientific, we are geologists, volcanologists, tsunami experts, but then discovered that the communication was fundamental, and not just doing fancy icons or just trying to articulate the work that they do, and with elements that you mentioned before, education, for example, scientific diffusion, or how you can divulge, can you communicate to the entire community the discoverings or the experiments that you are doing.
Well, it looks very professional work. I mean, it could be, sometimes the authorities, have the initiation to support this kind of project, but, maybe not the best men win. Luckily, I think your work is fantastic and the graphic products are really superb. So I think it's a win-win situation. Not always like that.
Thank you. Yeah, we're and open to collaboration and ongoing. We all the time we think this project as a continuous ongoing project. So we are also iterating from the previous versions.
And it includes research and evidence to support your work and your findings, which is super important. I mean, invoking Noah, what was his work? He wasn't the designer. Everyone in that enterprise was a designer, That's how those pictograms came to play. It's a group effort.
Thank you, Maria.
There's a question, sorry. have you actually tested this out with, you know, sort of an outside body? Say, for instance, I'm in Florida. As you all know, we just had Hurricane Ian devastate the western part of Florida. I mean, would you participate with a government body like that to sort of avoid some of the issues that have occurred? I know one can't avoid everything when it's so devastating, but what one's finding with the transition and the mobility of people since the pandemic that have been moving from different countries and or different states, there are people who have moved to places like Florida who've never even considered the thought of, there's a hurricane, what do I need to know? Yes, there are some public announcements. Yes, there are some information, but sometimes that doesn't always resonate. So I'm wondering whether some of the work that you've done, Rodrigo, could actually work in hand with some of the local government states, because that's another thing that one has in the US. You have these different states that have their own governing, they have their own bodies, and so therefore sometimes miscommunication happens. So I'm just curious if that's something that could, you know, you could support, or you think would be interested, or you've done that in the past with other countries or cities.
Yeah, well, the short answer to that question is not yet, but we start to involve with specific communities through the Department of Risk Management that is quite new in a country like Chile. Probably you know Chile because of the wine and because of the earthquakes. So the municipalities started 10 years ago or 20 years ago, after the last big earthquake, to develop these communal neighborhood committees. And in Florida, not, but through the Design Network for Emergency Management, we have these plans to amplify the network. So we are, Basula, very interested to work if you want. Not directly, but just if you want to take our material and adapt with your own students, we are very open to that also.
I'd love to collaborate. Absolutely. I think it would be of great use, and it would get notice in terms of starting from an education standpoint with students to expand into, you know, the business world and governments and cities. So,
and well, another thing, fact is the icon of hurricane, typhoon, is one of the worst evaluated. People doesn't understand. So I understand also the sensibility that creates in this hurricane season, that probably is a good opportunity to spread and evaluate.
Thank you.
I have a question for Carol.
Yes.
I loved your I love the word pictophilia. I thought that was great. We love making pictograms. How can you stop people making bad pictograms? I mean, if we love making them, I mean, that's why the Olympics, despite the idea that there would be some sort of relay from one to the other, they were stylistically quite different, actually, and they became much less human, I thought, personally. But the fact is that countries, you know, wanted to do their own thing, and so I'm sure that's the same with pharmaceutical companies. They want to make their own mark, literally. Are you proposing that there should be some standard that for the pharmaceutical industry that actually restricts people making their versions?
Not at all. I would, you hit the nail on the head, because it is I don't want to stop people making pictograms or illustrations, but the standards to start from is the patient's perspective, and and not a legal thing, or I would like to make pictograms, or we need to conform to the legislation. But the standard must be, how can we support patients when they're ill and need to take their medicines and follow a treatment?
Yes.
And it's not that's why it's a bit of a different approach from the emergency pictograms, because those are for large groups of people. But from a patient's point of view, every patient is unique and has their own context around them, with their own doctors and their own hospitals and their own financial situation, their own insurances, their own pharmaceutical industries. And each of these situations need to be tackled individually. And that means that we have to be very, make sure that the industry and the people around the patient actually support individual patients.
Yes.
And it's not to do, so the process must be, we start from individual patients to support individual patients, and not we have to support in Europe 560 million people at the same time, because that doesn't work. And so it's not one pictogram for all. It is, we need to develop support systems for individual patients. And if you have diabetes, or if you have a heart disease, or if you have epilepsy, or if you then we need to find out what these different patients need and base our information on that. And pictograms are important for that, but I can quite happily see that you need 15 different pictograms. Do not take when you're pregnant, for different groups of people who take this epilepsy medicine.
Right.
But not a million, not 600, or what did I say, 1,200 in the Noun project, but we need them specialized with text, animated, with music, whatever we need to convince patients, do not take this medicine when you're pregnant. And if you really need to take it when you've got epilepsy, then this is the procedure to follow. And that's a slightly different approach from what the industry and the regulators doing at the moment. They say, do not drink alcohol. That's the same in all situations for all patients. Well, not really. That's the wrong approach. Yeah, exactly.
It isn't. I seem to have a great tolerance for alcohol, whatever other pills I'm taking. So I guess I'm just lucky. But you're right. I mean, when I worked with Werman on various medical projects, we worked for CVS actually.
Yeah.
We tried to do something about their packaging, and they came with this long document that was stuck to the top, well, that it actually still is, of whatever medicine you got at CVS, which is a US company, a chemist. And they said, we're about to join forces with a Spanish-speaking company, and so whatever we've got on this piece of paper, we need to do in 2 languages. And so we, kind of joking, said to them, would it be okay if we did this in 2-point? And they said, yes, it would be, because all we've got to do is cover our asses. And if it's written down there, then nobody can sue us. I mean, it was absolutely ridiculous. Having done asked a few questions like that, we actually lost the account, which was not surprising. But I mean, Werman was very foresighted in a lot of ways. It still is. I'm sorry, he's still alive at 86, 87. But he said, there will come a time when you buy medicine that is designed for you.
Yeah.
So that if your tolerance is for half an aspirin, that's actually what you will get from your as your prescription. And if you are, I don't know, name another thing, a heart medicine or something, it won't just be one pill. it will be a pill that has got the contents that are specifically for you. And this hasn't happened yet, unless you know that it's beginning to happen. But I think that's the future of medicine, and that it wouldn't negate having to use pictograms and text and so on, because somebody else can pick up this box. Of course, that's what a lot of this is about, is that somebody else picks up the box and says, oh, I've got a tummy ache, I'll take this, and they don't know what it is. So anyway, I liked your talk, by the way. I thought it was very good. Thank you.
Thank you. Yeah, it will require a complete overhaul of legislation, and that's what I'm fighting for. We produce in Europe between 5 billion and 15 billion leaflets every year.
Yeah. Wow.
And most of them are thrown away.
Yeah. Yeah.
Let's just look at that. I mean, however well they are designed or however poor they are designed, we need to look at that. And if we can replace some of that information with visual information, either on screen or on the packaging, absolutely, let's do it.
Yeah.
Well, one of the poor things is
yeah. I think your key point actually was that the pregnancy thing shouldn't have been on the package, or it could be on the package, but it should certainly have been on the doctor's screen, because he's not looking at the package. He's been, yeah.
But that's with many pictograms in medical world, they're at the wrong place for the wrong people.
Yeah.
And it's not so much that they are poorly designed, although some of them are really, really bad.
Yeah.
But it's just they didn't think the context through.
Yeah.
And that needs, and that's why my point is, let's start from the patient's perspective.
Yes.
And that's what Rodrigo and Veerapong do as well. Let's start from the user who needs to escape.
Yeah.
And right. That's fundamental for developing pictograms.
Yeah. Yeah. True.
So that needs to be in the legislation. Okay.
Thank you. Thank you very much.